Communication is really important. Remember, communication is bilateral. You're communicating with the patient is communicating to you. It turns out, based on some pretty well done studies, that about 60% of all communication is not verbal, it's nonverbal. That can include things like how you're dressed, facial or other gestures. It can include how you sit or stand, where you put your hands, where your eyes go. Here's a couple examples. So if you're talking to a patient, you should be like this, as opposed to hands behind your back, which suggests to the patient you're hiding something. Always maintain direct visual contact with the patient. Don't look off to the side or up, which means you're disinterested. By the same token, the patient is giving you verbal cues. If you say something, what the diagnosis is, what your treatment plan is, and they go like this, that means it doesn't sound right to them. If they go like this, and they actually do itch, in fact, that's been shown, it means what you just said doesn't smell right to them. So they're not likely to accept your diagnosis, or they're not likely to do your therapy. If the patient does this, and their neck does itch, it means you're stressing them out. And again, they might listen to the critical things you just told them. It's time to repeat. It's time to emphasize, reinforce diagnosis or therapy to which they respond with those gestures. Also, if you're asking the patient questions and they look up and away, they may be lying when their answer appears. And lastly, watch where the patient's feet are pointing. There's a saying, the heart speaks and the feet follow. If their feet are pointed towards you, they're listening, they're engaged. But if their feet are pointing at the door, that means they're ready to leave. And anything from that point on in the encounter may or may not be absorbed, assimilated, and acted upon.